know for me, my heart rate kind of went crazy right after my brain injury. Um, and I've seen a lot of people post, they'll put a pulse ox on and they just stand there and their heart rate goes up and down and up and down and they're literally just standing there. They're not doing anything. So what can that tell us?
So you can imagine, we can kind of look at it from different ways. One, when you're just standing, it requires a different amount of feedback, right? Because it's different for your heart to have to pump blood up to your head than if you're laying down and it's just kind of flowing naturally to your head, right? So there are different components of vestibular receptors, the ability to kind of sense what's going on with where your head is at. When those systems fail, a lot of times we'll start to see that dysautonomia start to show a sign that's like a secondary sign that something's going on in that system. But then the other thing is sometimes if your brain's not doing very well, right? If it's overwhelmed, if it's being overworked, then we can see that even just at rest, doing simple things, your body kind of has to act like it's exercising in order to meet those energy demands. And I think both of those are common. So
Yeah.
it's very easy to be like, oh, you've got your heart rate's scooting up through the roof. You know, it's hanging out at 120 or 150 or whatever it is. And then you just do this protocol and that should help it. But the reality is that's just a really good sign that something is wrong. It doesn't tell you what exactly is wrong. It tells you something is wrong, which gives you the point to then jump from there and say, is this something that is metabolic component where my brain is just getting tired? How do I figure out what's making it tired? Is it that I'm not able to regulate where my head is in space? Is it that I have a neglect syndrome? Is it that there's something wrong with my eyes? Is it something wrong with my neck? All those things can be kind of the causes. So in my work, like that's what I spend a whole bunch of time working on is there's these heart rate components where it's very easy to see these little changes that happen in people that are abnormal and understanding where they're coming from and using that as a way to get them back. As you know, I mean, when your heart rate is screaming away on you or when your blood pressure drops, that stuff sucks. You get super dizzy. You feel real anxious. Sometimes you feel like you're nauseous, just like the life is being sucked out of you. I mean, it is super uncomfortable. So I think, especially with heart rate, you said you noticed like a lot of people would see your eye, but I think the heart rate component, when that starts acting up, is one that really grabs your attention. Is like, there's something going on here and we've got to solve this problem. So I think I see a lot more people that recognize like, this is bad.
Yeah.
And that drives a lot of people in. But I do also see, especially through Instagram and things like that, where people will identify as like, this is my problem, is that my heart rate is crazy. But then we usually have to take that extra step and say, like, well, what is making your heart rate go crazy? And then that's where stuff really gets cool because we can start to figure out what the problem is.
So this is a good like integration here. So often people end up going to the cardiologist because
Mm-hmm.
makes sense. That's what I did.
Yeah.
The heart rate's high, it's crazy. Like I walk 10 steps and my heart rate goes up to 150, right? Like shouldn't be that way. So a lot of people end up at the cardiologist and like I said, I ended up there. They did an EKG. They told me my heart was fine. Everything's just fine with your heart. But clearly something wasn't right. Um, so, explain how. So we've got cardiology, a traditional medical doctor, but then we have the functional neurology, which is what you do. Um, how explain the difference to people of how you look at this information versus what that cardiologist is looking at, because he, like I said, he just basically
Yeah.
did an EKG and was like, your heart's fine.
Yeah. Well, I mean, I use a cardiologist. I've had my own things in the past that have greatly benefited from that. But I think when you're thinking about those two different specialties, when you're as a cardiologist, my interpretation is kind of we're looking at something wrong with the heart itself, right? And as long as the heart itself is capable of doing the thing it's supposed to, then we're usually pretty happy about that.
Mm-hmm.
But then if you back out a step and you look at this kind of neurocardiac loop, you realize that while the heart is capable of creating its own signals, it's really controlled by your brain, by reflexogenic systems in your brain. You can't will yourself to change your heart rate. You can't just be like, you know what?
Yeah.
Let's bring that sucker down to
I've
65,
tried.
please. I have too. It doesn't work.
It does.
Um, so these are very reflexogenic things. They're in your autonomic system. But the ability to look at that and say, if this is reflexogenic, it means that it's relying on this machine to operate the way it should. And then it makes everything kind of normal, so to speak, right? So if I'm exercising, my heart rate goes up. If I'm resting, it goes down. All of that is there to keep my blood pressure stable. So if my blood pressure is going up, then my heart rate should go down to help me stabilize my blood pressure. It's like thinking about putting your thumb over the hose, right?
Mm-hmm.
So if I want to squirt it farther, I squeeze a little harder and put more pressure. I constrict it down more, more pressure. If I want to bring the pressure down, I let off. And that's basically the way that pump works for the heart. So if we're thinking about it from like a neurocardiac perspective, we're really saying like if that heart is working, but it's doing like it operationally can do all the things it should do, but in the context or the moment that we are in, it's not doing the right thing. Mm-hmm. It means to say that the controller, the thing that should be kind of, back there steering the joysticks, is not doing the right thing. And if it's a reflex, it means you're not making choices about it. There's something in the way that machine is working that's failing. And I think that with my colleagues is where we really get excited, because it allows us to say, how can we dig into that machine and figure out how to make it work better again? Because it's going to have a huge impact on this person's life. And that's the part that's exciting. And you can extrapolate that to thinking about anything in the brain, but just really understanding like, looking at a system and then saying like, well, if there's a problem in the heart, we have a surgery we can do, or we have like, there are other things that we can do. But if that heart is fine, it's the control system that we really want to get after. And then how do we use these little tools or these biomarkers to start to recognize, there's a difference in the brain if the heart rate is too slow than if it's too fast, right? That's pretty obvious. If you got one side of the heart that's beating differently than the other, then we know that's a thing. We know if we've got we've got like a blockage that's occurring, we know that's a thing. So it allows us to be able to put you in different contexts and understand what that means. So like a good example would be if you and I are sitting there, I'm listening to your heart and it's beating at 80 beats per minute, right? And then I have you turn your head to the right, and then all of a sudden it pops up to like 100 for a couple seconds, and then it pops back down. That simple motion of turning your head involves some different sensors that have to kick in. So then I can start to hunt down like, okay, is that coming from something in your neck that's causing that? Is that something that's in your inner ear that's causing that? Is it a dystonia component that's causing that? And then I can start to break it apart and look at like, what is at the root of this problem. So that's where it gets exciting. And that's why I start talking faster.